All right, ready. Hi, my name is Jessie. I am a Master's of Public Health Epidemiology student, and today I'll be talking about the implementation of stock rescue inhaler programs in Illinois schools. I'll discuss how we rallied stakeholders and identified facilitators and barriers to the current implementation process. Asthma is the most common chronic lung disease in children. 9% of Illinois children have current asthma, and that number is even higher in Black and Latinx children and children experiencing poverty. Children spend much of their day in school, which is a high trigger environment, and studies have shown that access to asthma relievers is suboptimal. School stock medication laws are a policy solution that can help combat these issues by increasing access to medication, as well as decreasing health disparities. In 2019, Illinois implemented its own stock asthma policy with the passing of Stock Asthma Rescue Medication in Schools Act. The act allows all schools to carry a undesignated rescue inhaler and authorizes trained personnel to administer the inhaler to anyone in respiratory distress. Despite the benefits of the act, implementation has been slow. And so the goal of this study was to understand the current facilitators and barriers to the implementation process through interviews with key stakeholders. There were two main parts to the study. The first was a stakeholder analysis, which we used to identify and engage community-based stakeholders. And then the second was a qualitative analysis that aimed to better understand the barriers and facilitators to the current implementation. We engaged in purposeful sampling of key diverse stakeholders for the second part of the study. Stakeholders were invited to participate in semi-structured interviews. Interviews were then transcribed and then coded and analyzed by an interdisciplinary team of 5 on the software Atlas TI. So this is the results of the first part of our study. We mapped stakeholders based on their influence and interest in school inhaler policy. So for our qualitative analysis, we focused on those in the top right quadrant, those with high influence and high interest in stock asthma policy. This included health advocacy organizations, government organizations like the State Board of Education and the Public Health Department, as well as school administrators and school nurses. Moving on to the second part of our study, we conducted 18 interviews with key stakeholders. The interviews took place between May of 2021 October of 2021 and May of 2022. And interviews were grouped based on their affiliation to one of two groups, Illinois School Health or advocacy and government organizations. I do want to highlight that among the school health group, school health personnel were from a variety of different schools, including urban, suburban, and rural schools and districts. A majority of those schools were also in high asthma burden counties. So the analysis highlighted numerous facilitators to the current implementation process. The light green color is the number of interviews with school health personnel that mentioned a specific facilitator. The dark green is the number of interviews with an advocacy or government organization that mentioned that same facilitator. So one of the most commonly mentioned facilitators was Champions, mentioned in 12 interviews. Champions are a person who goes above and beyond and who's instrumental in the implementation of stock rescue inhaler policy. So these were seen at all levels of implementation and across stakeholder groups. Other than Champions, facilitators fell at 3 different levels. The first level is at the school-based level. State District Has Funds was a very commonly mentioned facilitator. Also, adapting processes for other stock medications like EpiPens was also commonly mentioned. At the organizational level, finding a provider and partnering with a large manufacturer or pharmacy were commonly mentioned facilitators. And then at the policy level, the policy implementation dissemination was commonly cited, mentioned in 10 interviews. There were also numerous barriers. They once again fell at 3 levels. So at the school level, not enough nurses and too overwhelmed were very commonly mentioned barriers, which relate to a school health workload. We believe this is a barrier because the current implementation process is very lengthy and difficult and cumbersome. At the organizational level, pharmacy refusal to fill the prescription, cannot find a provider, and follow-up care hard were all frequently cited barriers. And then at the policy level, confusion over the law and liability concerns were commonly mentioned and relate to a lack of knowledge about the policy and act altogether. So overall, stock inhaler programs for schools can provide students with critical medication access, especially those in vulnerable populations. Currently, there is no framework for health-related policy implementation, which has caused many barriers and challenges in the process. So the creation of a framework for policy implementation is necessary for success of this program, as well as other policies in the future. A state level prescriber for stocks medications has been shown to promote sustainability. So it's highly recommended in Illinois and other states who are looking to enact similar policies. One large strength of the study is that it included a diverse group of stakeholders, which really allowed for a comprehensive analysis. While we did include a diverse group of stakeholders, it's impossible to gather all viewpoints. And there are very important groups like caregivers and children with asthma who were not included in the analysis, were not in the scope of the study. This analysis highlighted several next steps. So those included finding solutions to the most common barriers, identifying county level prescribers and statewide pharmacies will allow for implementations statewide, improving the implementation guidance and encouraging the training of additional staff members can reduce the burden on the nurses. Leveraging facilitators and champions is important for success. Champions are going to be really crucial in rural Illinois and implementing programs there. And then finally, engaging with our stakeholders to advocate for statewide funding is necessary for success, long-term success of stock inhaler programs. Thank you.